All right, welcome back. Of course, we are reflecting on the passing of Aziz Bahar, but let's take a look at other news making headlines in this hour. The Office of the Auditor General says that medical-legal claims against the Health Department are on a steady increase. The department and the AG briefed Parliament's Select Committee on Appropriations on the impact of medical negligence claims on provincial health budgets and mitigations on medical-legal claims. The AG's office says the claims from 2018 to the end of March this year stood at 77 billion rand. During this time, more than 15,000 claims were lodged against the department. The province with the highest number of claims is the Eastern Cape, with just more than 4,440 claims.
These claims are justified, and you can see from the presentation of the AG, which we really agree with their progress report, that they are justified, but others have really been found to be fraudulent, and hence the proclamation by the president to allow a special investigation unit to investigate the medico-legal claims.
Right, health activist Dr. Kgosi Letlape now joins us for a discussion on this. A very good evening to you, sir. Always good to see you.
Good evening to you and good evening to the viewers.
Dr. Letlape, we're talking about these claims, and the Deputy Minister there was speaking about the fact that, some of these claims are justified and some are, in fact, fraudulent. The fact that, these are being paid out either way, does this mean that, the Department of Health doesn't necessarily have an appetite to have these sort of long drawn-out court processes? So, they're rather opting to, sort of squash it and sort of settle outside of court. Is that what we're finding? Because that would be quite concerning, considering what a huge chunk of the budget that is.
I guess the issue of settling out of court would be based on the merits of the case.
Yeah.
If you don't have a defense for what is being claimed, it is best to settle rather than a protracted court battle.
Yeah.
But I think more importantly, we need to reform the legislative framework that surrounds these issues. We need to go to a no-fault compensation system where people that are harmed through care don't need a lawyer to be compensated for the harm. That would limit the fraud, that would limit the loss of money, that would limit the profiteering by legal practitioners from people's misfortune.
Yeah.
And it's about time that the department looked at implementing a no-fault compensation system. But in addition to that, we've got to improve our facilities. We've got to ensure that our facilities are well equipped and are adequately resourced in terms of human resources. And we need to be able
Dr. Letlape,
have a small part for each hospital.
Yeah, Dr. Letlape, how will we get to this point where, hospitals and clinics are adequately resourced when you've got 77 billion rand that is, going to these medical negligence cases? And as I was saying, just reflecting on that sort of budget and wondering how much it trickles down and then affects the entire system.
Yes, and that's why we need to come with radical solutions. Otherwise, this component will be the biggest chunk of our health expenditure, and there'll be very little left to provide adequate and good care. So we got to see it as a crisis and something that needs to be dealt with through legislative measures, but also through ensuring that the facilities are appropriately equipped, appropriately funded, and the human resources are adequate. If we don't do that, then this type of expenditure can only increase going forward.
Yeah. Doctor, when we talk about negligence, we're obviously talking about something that must cause damage. So, the patient, must then prove, or through his legal representative, prove that, some sort of damage was indeed suffered through either, an act or an omission caused by the medical practitioner. What sort of claims are we seeing here fundamentally? Yes, they are negligence related. There's been an omission or an act. But what do you believe to be being those that are, justified? What cases are we sort of looking at here?
we will have to move away from this issue of presumed negligence. Because you can go through a procedure and without any negligence be harmed through that procedure. That's why we need to look at a no-fault compensation system. Because what happens is there are many people that have been harmed, that don't have the legal representation, that don't have the ambulance chasers finding them, that don't have any recourse to justice. So we need a fair system that takes legal practitioners out of it, so it doesn't become an issue of affording legal representation or having been found by legal representatives. The other issue, once you go no-fault compensation, you are also able to look at what is it that people should be paid out for. If it is for future medical expenses, those medical interventions will be done in the public healthcare system. So what you need to be guaranteed is care going forward rather than huge payments.
Yeah, and that's actually what I wanted to ask. I mean, when I look at this figure, the 77 billion rand, surely this points to, some sort of, indictment on the health department at large and the public health in general. I mean, we should be concerned, surely, about that there are so many cases.
I think one of the things that we should not overlook is the fact that there are many legal ills out there that are out of work and have now targeted health as a place to make money. In some of the cases, they lodge a case and there are no records. The records cannot be found. And without the records, the department cannot provide a defense because the records are missing. Now, we need to deal with that situation, because I ask myself a question. How can you make a claim if you can't base it on records? Why are we able to have people lodge claims when records could not be found? And records disappear, and people know that when they claim, the department will not have a defense. We need to ensure that we improve the healthcare system where we keep electronic records. I mean, in this day and age, why are we still keeping paper records? Because if the system becomes electronic, records will not be lost because they've been captured electronically. They are in the cloud, and that will mitigate towards not being able to mount a defense, because in some of the cases, it's because records have not been kept. So the improvements in the system would require installation of a national health information system throughout the whole healthcare system. So the issue of records not being available becomes an issue of the past to start with.
All right.
Secondly, you are able to know whether an institution is fit for purpose in terms of its beds, the human resources required, and its capital requirements being met. With insufficient facilities and insufficient resources, we just a sitting duck for unscrupulous legal practitioners to make billions of rands out of the system. And it does not necessarily mean that those that have had harm, that have been harmed by care, will get the benefits of these huge payouts.
All right, Dr. Letlape, thanks very much for giving us your time. Dr. Kgosi Letlape is a health activist and medical doctor there, talking to us, of course, about the medical negligence claims that have indeed, we've been seeing a rise in that 77 billion rand worth of claims from 2018.